Hello, I am Dr. Hari Kishan, consultant physician working at Yashoda Hospitals, Somajiguda. Today I am going to talk to you about typhoid. Why typhoid? Typhoid is such a common infection. Everybody knows it's easily diagnosable, it's easily treatable. That's what everyone thinks. But of late, we've been noticing a change in trend. First of all, let's talk a little bit of typhoid. How does one get typhoid? By contaminated food and water. So that's why be careful with what you eat, especially when you're eating outside. Make sure you eat well food. Okay, drink only hygienic bottled water. Simple thing. And people who travel a lot have to eat outside often. There is a vaccine for typhoid, gives you about 60 to 70% protection. Okay, so it's important that you get vaccinated for typhoid. So why vaccinate? Why get vaccinated for typhoid? It's a simple infection which is treatable with probably 5 to 7 days of antibiotic. That's a common notion. But what we've been noticing is that many people, despite antibiotics, they are taking longer time to respond. Sometimes we are seeing drug-resistant strains. And when it comes to diagnosis, there are issues with typhoid diagnosis. It's often either overdiagnosed or underdiagnosed. The so-called Vidal test. There are a lot of methodological issues. Even in a good lab, we need to interpret with caution. That's why if you have fever beyond 4 to 5 days, it's important that you give a blood culture. Because your blood culture, in the first 1 week of typhoid, there is 50% chance that the blood culture will grow typhoid bacterium. And if the typhoid bacteria grows in your blood culture, then the diagnosis is certain. And then once your diagnosis, we are certain about your diagnosis. We know what antibiotics to use, how long to wait before we change the antibiotic. Because even with an appropriate antibiotic, it may take 5 to 7 days sometimes for you to respond. And if you don't give adequate duration, many times they might have been suspect to have typhoid, they received some antibiotics. After a week again, they come with recurrence of fever. One of the reasons is that they had inadequate doses and inadequate duration of antibiotics. So once we suspect typhoid or confirm typhoid, it's important that we give adequate duration. The course should be of adequate duration, at least for 7 to 10 days. So when it comes to typhoid, it's important you prevent. How do you prevent? Food and water hygiene, vaccination. Then the diagnosis, it's important that you do a blood culture besides the standard serological test. Ensure that you receive adequate duration and dosage after required antibiotic. Thank you.
Like, comment, and subscribe for more health updates.